What's going on, guys? Tony Maritato here. So in this video I want to talk about my 3 favorite strategies for reactivation of a past physical therapy patient. Now obviously this applies to any medical practice, but reactivating a past patient. So this is a patient that has been discharged, who was a patient that you enjoyed having in the clinic. It was a patient that responded well to therapy, and it was a patient who would likely benefit from coming back to therapy for follow-up care beyond the discharge. Now, why reactivate? Well, I never imagined this, but I found out and I realized that some patients are reluctant to come back to physical therapy because they feel like a failure because their symptoms may have returned. Maybe they know that they didn't do their home exercise program the way they were supposed to, or maybe they got busy with other things going on in life. They have their symptoms returning. Maybe it's shoulder pain, back pain, hip pain, knee pain, and all of a sudden they want to come back, but they feel guilty coming back because they're embarrassed. And so you, as the therapist, reaching out to them, letting them know that it's okay, letting them know that it's normal, it's a huge opportunity for them to get the services that they need. So reactivation of physical therapy patients, it's not just about marketing, it's about legitimately improving your patient outcomes. So the 3 strategies, they're super simple. 1 is going to be checking calls. 2 is going to be checking letters, and 3 is going to be leveraging the power of a refund. Now, I wrote an article on the learnmedicarebilling.com website if you want to go check it out, but let's run through these 3 in super fast motion. So, number 1, checking calls. Super simple, right? 4 weeks, 6 weeks after discharge, you're going through your patient list. You see some patients that you enjoyed having in the clinic, you knew genuinely benefited from therapy. You give them a call, you say, hey Mary, how's it going? I haven't seen you for a couple weeks. I know this is the time that usually pain starts to come back. I just wanted to check in, see how you're doing, let you know that if you want to pop in for a follow-up visit, you're more than welcome to. This is usually the time that patients come back. And that's it, no pressure. They tell you they're doing great, awesome. They tell you they want to come back, you book them, and that's all there is to it. The check-in letter. Now, I know a lot of therapists don't feel comfortable calling patients. They feel salesy. They feel like a used car salesman, and it just feels dirty to them. That's fine. That's their own problem. That's their baggage. But if you are working with clinicians, or if you are a clinician who doesn't want to call a past patient, you can send a letter to check in on them. The letter effectively says something like, Mrs. Jones, this is Tony from Physical Therapy. I was reviewing some old accounts and your name came up. It's been about 6 weeks since we've seen you from discharge. I know that this is usually the time that the shoulder pain or the hip pain or the knee pain starts to return. So I just would love to hear from you. If you want to give the clinic a call, let me know how you're doing. If you do have some symptoms, you're more than welcome to come back in. We see a lot of patients who come back right around this time. And that's it. A lot of them will call. And I would tell you, as kind of a little bonus tip, one of the things that you should be doing as a clinician / practice owner is you should be creating a prioritized list. Now, I like to color code my list, so I've got patients that are highlighted in green, patients that are highlighted in yellow, and patients that are highlighted in red. And so my greens are top priority. I want them back in the clinic when appropriate. Yellow is, they did pretty well, but I'm not going to force them. I'm not going to try and make them do something that they might not want to do. And red, of course, is self-explanatory. So check-in calls, check-in letters, and then finally leveraging the power of a refund. So there are times where when you're operating an efficient billing system, you should never be sending invoices because you should be calculating an estimated cost of service and collecting at the time of care. That results in little refund checks that probably have to go out periodically. $20, $30, $50. Patients don't want to get an invoice in the mail, but they would love to get a refund in the mail. So this gives you the opportunity to call that patient and say, hey, Mrs. Jones, great news. Apparently the insurance paid more than we expected. I have a check sitting in front of me for you for $32. It's been a couple weeks since we've seen you in the clinic. I wanted to know how your shoulder's doing. This is usually the time that the symptoms will start to come back. So if you want, you can come in. We can do a tweak, like tune-up session. We can do a little bit of work on it, show you a couple things to upgrade your home exercise program. You can take the check with you. or I can just drop the check in the mail if you're doing great and you don't need therapy. And that's it. So those are 3 really low pressure, easy ways to reach out to patients, let patients know that you're still thinking about them, that you still want to help them. And in a good situation, if the patient needs the service, it gives you the opportunity to reactivate a past patient. Now in another video, if you want me to talk about the logistics of, do I do a new eval? Is this a re-eval? How do I document for something like this? Just let me know, because I've got all those systems worked out. We've been doing this for over 20 years. But I just want to share some ideas with you, and if you want to check out the website, it's learnmedicarebilling.com. Catch you on the next one.